Hi, I'm Dr. Rehrig. Over the years, I've had so many people that have recommended I write a book. And the reason for that is I have all these ideas and then information that I've gleaned from other sources, books and seminars and so forth. But I decided that right now that's not going to happen. So I'm going to kind of have sessions like this where I discuss some of the things that I think would be important to know for you, and hope you get something out of it. But my first discussion is really one of my pet peeves when it comes to a diagnosis. And the medical profession is very good at giving a diagnosis. However, the diagnosis rarely actually leads to the reason a person has a problem. For instance, if somebody says, "My leg's moving all the time," they say, "Well, your diagnosis is restless leg." And of course they always have a drug for that. They go, "Well, I'm tired all the time." They go, "Well, you have chronic fatigue." And you go, "Oh." And so they might have something for that too, and then they go, "Well, you know, I just seem depressed." And they go, "Oh, well, you're clinically depressed." And then they have something for that. And I heard all over, I just ache, everything aches, my joints, my muscles. "Oh, you have fibromyalgia." Now, each one of these quote-unquote diagnosis is actually, if you think about it, it's a label for the symptom that you're getting here. If you can see my little iceberg, the real problem is here. So if you have restless leg, you actually don't have restless leg. You have restless leg, but it's secondary to something else. So there's a reason behind it. That would be down here. If you're tired all the time, you really don't have chronic fatigue. You have chronic fatigue secondary to something that's going on down here. It might be a hypoglycemic problem. It could be a low thyroid. Maybe the adrenals are exhausted. If you're hurting all over, body could be out of alignment. I'm a chiropractor. I fix bodies, and that's a common one. My point is this: the diagnoses we're getting are actually not actually telling us what the problem is. So at the Rehrig Chiropractic and Wellness Center, we really don't care much about the symptoms other than their clues. And we need to know the clues. There's nothing wrong with that, but we know that the symptom is really not your problem. And our focus is finding what's going on down here. Because who cares about this if we're never going to find out what's going on here? So if somebody has fibromyalgia, or they have tiredness or stress or depression, we're really trying to find out what's the cause behind it. And once we find that, then of course the actual symptom will clear up. So I'll give an example. Let's say somebody is tired all the time, and we find out that they're under a lot of stress. Well, one of the key problems they will have is weakened adrenals. And your adrenals, you have two of them. They're on top of each kidney back here. They're your stress glands. And stress is accumulative. So it's not the stress you had last week or last year. Stress adds up into a body. Over time, the adrenals get beat up, and they don't function so well. One of the things that the adrenals control is blood sugar. When the blood sugar starts fluctuating, high, low, one of the symptoms of that is actually depression. You get a lot of other symptoms from that too. Many physical types of aches and pains and troubles, symptomatic pictures, are actually coming about because weak adrenals. And the weak adrenals came about because of what? Stress. So most people go, "Well, that makes sense. I'm under a lot of stress, or I have been. I could see where my adrenals could be weak." If they can see that their adrenals could be weak, then they can start to realize that the symptoms then could be coming from a cause. Could be a reason behind it. And so a symptom does not tell you the reason behind the symptom. It doesn't tell you why. And again, just to reiterate, at the Rehrig Chiropractic and Wellness Center, that's our focus. We help people find out why they're having the problems. They like that because it makes sense to them. And so that's my plug for the Rehrig Chiropractic and Wellness Center today. I hope to get back to you and give you some more information specifically about the types of conditions that we treat, and the types of things that we find that help to lead to a relief of the problem and not just a symptomatic relief. All right, goodbye.